For my presentation on cultural competency in nursing, I spoke with Christy DeVries. Miss DeVries attended the College of DuPage, completing her associates in science, and then transferred to Rush University, graduating in 1993 with her bachelor's of science in nursing. She worked at Rush University Medical Center in the acute care setting from 1993 to 2000. Then from 2000 to 2001, worked as a home healthcare nurse. She took a 10-year break from working as a nurse while she was having children and homeschooling. Then she went back into the workforce as a nurse at a physician's office. Her unit at Rush University Medical Center was a combined bone marrow transplant and hematology-oncology unit. Also in her unit, lung transplants were performed and primary pulmonary hypertension was treated. The patients on her unit were very diverse, but primarily African American and white, including European and Russian, but also many people from all over the world were seen. At Rush, her roles included being a floor nurse, caring for all the basic needs of patients, and as a charge nurse, overseeing the other nurses on the floor and ensuring all patients were receiving quality care. She aided in unit research projects involving tracking of charts to find gaps and weaknesses in the unit and sharing that information with the staff to improve the unit's performance. When asked about her thoughts on the importance of cultural competency in nursing, she said, "It is very important. You need to be able to communicate with people of many different cultures, some of whom don't even speak English." She shared that as she worked at Rush in the city of Chicago, she had seen some patients who couldn't even speak English, spoke only Spanish, Polish, Arabic, etc., and translators were not always available, causing her to use nonverbal indicators. She also spoke to the importance of being aware and knowledgeable about different cultural traditions, like the role of men and women, particularly in Middle Eastern cultures, the roles of family and the amount of family present, how different cultures grieve for the dead and dying, and how different cultures view medical staff, because their perception of the medical staff will impact how they respond to the nurse's teaching and advice regarding their health. Christy also shared that she had encountered some patients who were Jehovah's Witnesses. She shared that it was difficult to see some patients in pain due to them rejecting certain procedures. When asked how she handled those situations, she said that after you explain to them the risks and benefits and have given them enough information to make an informed decision, then you have to respect whatever decision they choose to make. She said that after she informed them, she never tried to talk them out of their choice. When asked if she was able to use any knowledge of a certain culture to better relate to her patients, Christy shared that her knowledge of the Hispanic culture helped her in many ways. She indicated that Hispanic cultures are more relationally motivated, so when treating Hispanic patients, she would focus on building a personal relationship, because they were much more receptive of the information about their health with that relationship as a foundation. Where with the European crowd, the interpersonal relationship, while important, did not enhance the experience and the information she was sharing as much as the Hispanic cultures did, because the European cultures seemed not to have that relational expectation. Christy also shared that not only is their cross-cultural dynamic between the patients and the nurses, but there's also a cross-cultural dynamic between the differing healthcare providers. She shared that in working in an inner-city hospital, many of the techs, nurses' aides, people who transported patients, and clerks were from a different culture than she, namely an urban culture with a lower socioeconomic status and educational level than the nurses and doctors. She shared that these differences must be overcome to provide the quality of care patients need. When asked about her thoughts on the impact of the culture of healthcare profession on patients' outcomes, she said if you're not ultimately there to serve the patient, you aren't going to be effective. If you're self-focused and don't care about the patient, you aren't going to be interested in their best interest. You won't share the knowledge and information and teach them in the same way if you see them as lesser than you. That's why it's so very important to set a culture in healthcare field that is service and patient-oriented. When finally asked what advice she would give to nursing students about cultural competency in nursing, she shared, "The most important thing to know is your patients. Be astute, Be a learner and observe nonverbal cues, adjusting your approach based on the feedback you're getting from your patient. Nobody can know everything about every culture, but you can and must be aware.